Many years ago, I decided that there was a better way to practice family medicine, that the patient wasn't involved in the care as much as they should be. And I started to take control of my practice. I decided to go back to the roots of where I started, and I took more of the management positions of the practice. And because of that, I went to a conference in Mount Pleasant, Michigan, just north of us, and I met a man named Bob Vosberg. Bob was an engaging speaker who really stimulated my interest in what he had to offer. And I'm here today to tell you about Survey of Vitals, which really has transformed my practice. Bob told me about a survey instrument that he had developed that not only was scientifically proven, had evidence base behind it, but that it was economical and affordable for a small family practice like mine. And so I developed this relationship with Bob, and I began to learn about this product, Survey of Vitals, which, like I said, has just been really a godsend for us in our practice. We are embarking on change in our practice toward a model of care called a patient-centered medical home. Patient-centered medical home is about putting the patient's needs first above the doctor's needs, which is typically what we haven't done in the past. And the thing that you have to realize is that you have to understand what the patient needs. And there's only one way to do that, is to ask them. Now, how many of you ask your patients what they need on a daily basis? How many of you ask them whether they're satisfied with what they receive in your office? You cannot transform your practice or change your practice unless you have this information. Most of us, however, maybe in the past have developed surveys that were maybe on a piece of paper, and you asked 5 or 6 people, but they were on paper, you weren't able to coordinate the efforts, you weren't able to really take the results and use them to really transform your practice. Well, the instrument that I've been working with the help of Bob and Survey of Vitals, has done something different for us. It's been able to quantify our results and our data, and to transform the way we interact with our patients and try to meet their needs better. Medical home is not about making things easier for the doctor. It's about making things better for the patient. There's a motto in our office that we have hanging back in our lunchroom, and it says that people really won't care what you know until they know how much you care. How do you know what's really important to them? You have to ask them, and you have to survey your patients. You have to ask them what they need. No longer are the days where you can just put your shingle up and expect the patient to come to you and you tell them the way it's going to be. It hasn't worked. That method hasn't worked. So you have to ask them what it is that you need to improve their experience. And so through this instrument, I've been able to do that.